everybody. My name is Dr. Greg Tanner, and I'm an orthopedic surgeon with OrthoVirginia in Richmond, Virginia. And today we're going to talk a little bit about arthritis and joint replacement and the advancements lately that we have with robotic and computer-assisted joint replacements. So I specialize in shoulder, hip, and knee replacements. And over the course of my training and career, we've had a lot of advancements, just like we have with any other technology within our society, to where we used to just do things very average for a person, where we had measured angles and standard instrumentation, and now being able to tailor replacements more specifically to a person, to their alignment, their anatomy, and their disease, their arthritis. And each joint replacement, shoulder, hip, knee, ankle, wrist, elbow, they all have unique characteristics to the anatomy that is being replaced. But with newer technology, we can control where those implants are going in to get the desired alignment and replace them more relative to the patient compared to previously just on average. There's a bunch of ways we can do this. Some use just the x-rays we have in office and things that we find in the OR, where other systems use CT scans or even MRIs to develop guides or robots that help us execute making the right cuts and putting the implants in at the desired location. Each system with a different company uses different ways to do it, and each surgeon is trained on different systems in order to do these different types of technologies. But they're allowing us to do implants better, faster, with more confidence, and better alignment than we ever have been before. So if it's okay, we'll open up and have some questions.
Thank you, Dr. Tanner. What robotic system do you use?
I use a couple different ones. Most often I use Mako, which is a Stryker product. That is a product that requires a CT scan before surgery for the hip and knee replacements. And then based on that CT scan, we have the bony alignment and disease, and we can tailor those implants based on that. There are some other systems. DePuy has the Velis, Zimmer has the Rosa, Exactech also has a shoulder technology that actually just use the x-rays that we have in the office in correlation with what we find in the OR to use, to not have to require a CT scan to be able to balance implants in that way.
Thank you. When you're doing surgery using a robot, is the robot moving on its own? How does that work?
That's a great question. So when we talk about a robot for surgery, it's us correlating the patient's anatomy to either the CT scan or to a design model with the more navigation units. And then we can tell the robot, okay, I want this at certain degrees or certain millimeters. And then that robot is basically an arm that helps keep our guide or our saw at the right position to what we have told it, this is where I want it to be. So it's not that the arm does the cutting or moves on its own, but it helps us stay at the right path for the exact alignment that we want it to be in.
Thank you. How does using the robot change the length of time of surgery?
Depending on the surgery, each one is different, shoulder, hip, and knee. But we're improving the systems to the point where we are about time neutral, maybe adding a few minutes on to the surgery time. Initially, the first time you use it or two, it might add significant time. But as you get more experience with it, it becomes close to what a previously done joint replacement would do.
Thank you. Do joint replacements done using a robot count as minimally invasive, or how does that work with relation to the robot?
Yeah, minimally invasive is an interesting term that it's more of a selling point. There's no definition for minimally invasive. Most people consider it based on the size of their scar, but the actual skin cut or the scar that you see doesn't really reflect on the surgery that goes on underneath the skin in regards to the tissue, the ligament, or the bone that's taken away. So with robotic technology, sometimes we have some extra pinholes, but the size of the incision is pretty similar, sometimes a little bit smaller than it was before. But to call it minimally invasive is a little difficult because there's not a strict definition of what is or isn't minimally invasive.
Thank you. What is the eligibility for having a robotic joint replacement?
If you're a candidate for a joint replacement, then you should be a candidate for a robotic replacement. The robot is just a tool that we are using to execute the plan that is best for you, not so much that there is someone who would or wouldn't be a candidate for a robot versus not having a robotic assistant.
Thank you. During the surgery, how does the robot know where to move everything? How does it know where my body is?
Great question. And that's what the CT scan with Mako, or once you've registered the bone with the navigation systems, correlates in space to these markers that use a technology to a computer array that sees these points in space. And these arrays are fixed to the bone and they don't move. So once you've registered the bone, the computer says, okay, I know the shape of the bone and I know it to within 0.1 millimeters. So extremely fine accuracy. And based on those arrays and where they stay fixed to the bone, with motion of the knee, let's say in a knee replacement, it says, okay, I know that in this position in space with these markers changing in certain angles, it does the calculation to say, well, I know that this is that part of the bone in this position. As you move it, the computer adjusts and it knows where that position is based on that array.
Thank you. I want to encourage everyone to go ahead and put your questions in the comments section. Is the recovery time different for a robotic surgery than for a non-robotic surgery?
Right now, they're about the same. Robot surgery allows for a little less exposure, a little less cutting of the tissue below the skin, as I mentioned. So sometimes we think that we actually recover a little quicker with the robot, but by and large, it's pretty similar in terms of achieving motion, achieving flexion. No matter what, as all things go as planned, you're up and walking the same day, you're working with therapy same day, and as you progress over the coming weeks, you work with more physical therapy to get back your motion before surgery.
Thank you. We have a question in from someone saying that their sister just had a robotic knee surgery recently, and it seems like the robot arm may have rested on her leg during the procedure. Is that common?
I wouldn't say it's common. Not a situation I've seen happen yet, but I suppose if certain positioning occurred or things like that, that perhaps that was, laying on her. I'm not sure how they would have known that. Maybe is there like indentation or a bruise or something abnormally? I suppose it could happen, but if you're paying attention, you should see if it's going to happen and prevent it, of course.
What's the difference between the CT scan, the x-rays, and the MRI that you mentioned having before surgery?
Right. So to determine that you have arthritis, every clinician will get x-rays in their office preoperatively as you show up, with your complaint of pain of the joint of whatever's bothering you. So we'll get the x-rays and we'll be able to tell, is there cartilage loss or is there arthritis? Now, if we get further imaging, a CAT scan is more radiation. It's like x-rays, but they act like a loaf of bread. So we're able to cut that in different planes, but it's a lot higher radiation dose. But that correlates for like the Mako system. An MRI does not use any radiation. It's a big magnet that aligns our water molecules within our cells. And based on that, we get pictures better of the soft tissue than the bone compared to like a CT or x-ray. But it aligns to get that 3D image of your soft tissues. There are certain systems that used to make guides for knee replacements based on MRIs. They're not very common right now, but these robotic systems are looking to go into MRI-based imaging also as their information as they go into surgery. So it depends on the study, what it's looking for, what it's skilled at, and it depends on the robot as to what it needs to be able to use it for surgery.
Thank you. How as a surgeon were you trained to use the robot? Is there extra special training?
There is extra training. I received it through my fellowship where we used it heavily, but every surgeon has to go to a course at the facility to be informed on it and practice on it and learn how to use it safely, of course. You wouldn't want to get into surgery and cause a problem because you just didn't know how to use the tool, because that's what it is a tool to execute what we're trying to do. So there's extra training, at least from a short course. In my case, it was during my education. But then as these new technologies come out, frequently do visits with surgeons who have experience with it. We see it firsthand, and then we practice on models before we ever use it on one of our patients.
Thank you. Can you expand a little bit when you say you practice on models? What do you mean by that?
So there's a couple ways to do this. Number one, we call them sawbones, and really they're a styrofoam plastic model, and they're the shape of the bones that we all have, and that's a system that you can do anything you want. They're a piece of plastic, and we throw them away, and we use them frequently in residency training and everything because you can just keep doing them. It's a cheap model that we can use for training. We can do many of them, and it's low cost, and you get good experience out of it. The other thing we use are cadavers, so people who have donated their body to science. If you've already done the sawbones, if you've already seen how these technologies work, then we can do them on cadaver models so that you're actually seeing real bone, real ligaments, how to protect the right structures, and how to use it to its best ability.
Thank you. Is using robots during surgery like playing a video game? Are you using a controller and then something else is happening? Or how involved are your hands yourself?
Right, that's a great question. It is a little bit like a video game. And I think that having seen some older or more age-experienced surgeons seem to struggle more with using it or learning it than do the younger people. And a lot of us, one of them, think that it's because of our younger generation's experience with video games and the finger controls. We don't have a controller like a video game, but we're registering points of the bone with a tool to say, here is the spot, now let's go to the next spot so that it can learn that map of the bone. And it seems like for our younger generation, as more of that experience, we're able to do that quicker and more accurately. Whereas people who have less computer or video game experience seem to struggle a little bit more with that computer registration accuracy.
Thank you. When you're doing surgery and you're using a robot, are you looking at the joint itself or are you looking at a TV screen?
We're looking at the joint ourselves, but there's a monitor near the camera usually, and we're correlating it. So as the computer says, I want this or show me that, then we're looking at the joint ourselves to be able to show it that and to be able to register that.
Thank you. Does insurance cover robotic joint replacements? And if so, does it cost more generally for patients? I know it can vary based on the insurance plan.
Right. Insurances do cover it because as of now, there isn't really an extra bill for it that insurances cover. So most providers that use it are not billing that extra cost. Some providers I have heard bill the extra cost and they pass that on to the patient, but that's going to be provider specific. Most people that I know are just not billing for the usage of the robot. It's just that this is the tool that we're doing standard surgery with.
Thank you. Is there ever a time where a patient would choose not to do the robotic replacement?
Yeah, that's a good question. I think that's a personal preference. I don't think I have encountered anyone yet in my few years that has said they didn't want it. But I imagine there's someone out there who would not want it for sure. Appreciate you guys logging in and watching, and it's my pleasure to try to educate you in the needs that you have. So if I can do anything else to help you, I'd be happy to.